Safety, Sanitation, and Sterilization. Section 1. Hand washing and use of gloves. Hand washing is the single most important procedure for preventing infections. Hand washing is defined as a vigorous, brief rubbing together of all surfaces of lathered hands, followed by rinsing under a stream of water. Although various products are available, hand washing can be classified simply whether plain soap or detergents or antimicrobial containing products are used. Hand washing with plain soaps or detergents suspends microorganisms and allows them to be rinsed off. This process is often referred to as mechanical removal of microorganisms. Because of the potential for the technician's hands to come in contact with the client's blood, a fresh pair of non-sterile disposable examination gloves should be worn by the technician during the treatment of each client to protect the client from potential exposure to microbial flora of the technician, including bloodborne organisms, should there be cuts, scrapes, or microlesions on the technician's hands. The microbial flora of the skin consists of resident and transient microorganisms. The resident microorganisms survive and multiply on the skin and can be repeatedly cultured. Transient microorganisms, often found on the hands, can be pathogens and may cause infection. Hand washing with plain soaps and detergents is effective in removing many transient microbial floras. Hand washing is indicated before and after treatment of each client. Hand washing is indicated before putting on gloves and immediately after gloves are removed. It is recommended that a vigorous, brief, at least 10 seconds of rubbing together of all surfaces of lathered hands, especially between fingers and fingernail areas, followed by rinsing under a stream of water. If hands are visibly soiled, more time may be required for hand washing. Hands should be dried thoroughly with a disposable paper towel. Faucets should be turned off with the paper towel. In addition to hand washing, non-sterile examination gloves should be worn as an extra margin of safety. When gloves are worn, hand washing is recommended because gloves may become perforated during use and bacteria can multiply rapidly on gloved hands. Torn or perforated gloves should be removed immediately and hands washed after gloves are removed. Non-sterile gloves can be worn when hands are likely to be contaminated with potentially infective materials such as blood, body fluid, secretions containing hepatitis B virus, or other pathogens. Non-sterile gloves are appropriate for intradermal cosmetic procedures and are recommended when hands are likely to become contaminated with potentially infective materials such as blood, body fluids, or broken skin. A fresh pair of non-sterile disposable examination gloves should be worn at all times by the practitioner during the treatment of each client. If a treatment session is interrupted, a fresh disposable plastic overglove should be put on over the gloved hands, or gloves should be removed and discarded to handle the interruption. If gloves are removed, hands should be washed and a fresh pair of gloves worn to resume treatment. After a treatment procedure is completed, gloves should not be removed until the needle or tubes are placed in a holding container of germicidal solution and all contaminated disposable items are discarded into containers lined with plastic bags. A fresh pair of gloves should be worn during the pre-cleaning, cleaning, rinsing, and drying of instruments prior to sterilization. Great care should be taken to avoid needle stick injuries. A practitioner should refrain from direct contact when the practitioner has exudative lesions or weeping dermatitis until the condition is resolved. Section 2. Cleaning and sterilization of instruments and other safety precautions. All procedures in the practice of intradermal cosmetics result in breaking the blood barrier and should always be viewed as paramount when developing strategies for client safety. Intradermal cosmetic procedures are invasive in that the needles are mechanically inserted into the dermis layer of the skin and come in contact with normally sterile tissue. Penetration of the skin results in contamination of needles and the tube housing the needles, with blood, serum, and other material on the skin. The procedure of implanting pigment within the dermis layer results in blood contamination of instruments, pigments, and pigment containers, and related surfaces. Critical care items are those that come in direct contact with the bloodstream and other normally sterile areas of the body. Therefore, tubes and other contaminated objects must be thoroughly cleaned and then sterilized before reuse to reduce the transmission of infection and disease. Cleaning is the physical removal of organic material or soil from objects, and is usually done by using water with or without detergents. Generally, cleaning is designed to remove rather than kill microorganisms. Technology has provided cleaning products and devices that are especially for the cleaning of instruments used in intradermal cosmetics. The two recommended methods of sterilization or instruments used in the practice of intradermal cosmetics are dry heat or moist heat, or steam under pressure, also known as autoclaves. These methods are standardized and can be routinely monitored for effectiveness. After each treatment is completed, and before glove removal, contaminated needles and tubes should be placed in a holding container of germicidal solution. Thereafter, a fresh pair of gloves should be worn and needles and tubes mechanically pre-cleaned to remove organic matter, like blood and tissue and other residue, using a clean, non-sterile cotton ball or swab moistened with a solution of low-residue detergent in cool water. With care taken to ensure removal of any pigment inside tubes not visible to the eye, then placed in a holding container filled with low-residue detergent in cool water. Instruments should be submerged into the soaking solution to keep any remaining organic matter from hardening, while instruments accumulate during pre-cleaning for the next procedure. After cleaning has been accomplished, the container should be held under warm water to float off the cleaning solution. After the instruments are thoroughly rinsed, the container should be tilted to drain off the water. An optional final rinse with the distilled water may be used to remove hard water deposits from the instruments. After final draining of water or distilled water, instruments are ready for the next procedure. The container of clean instruments should be placed on a clean surface which has been covered with a layer of plastic wrap and several layers of paper towels. Cleaned instruments should be transferred with gloved hands to the paper towels and dried with additional paper towels. Care should be taken to avoid needle stick injuries. Sterilizers should be registered with the FDA and should be cleaned, used, and maintained according to the manufacturer's instructions. Dry heat ovens and moist heat autoclaves should have visible indicators like thermometers and timers. Following time-temperature relationships are recommended, including but not limited to the dry heat method should be at 340 degrees Fahrenheit, 170 degrees Celsius for 1 hour, and 320 degrees Fahrenheit, or 160 degrees Celsius for 2 hours. The above temperatures relate to the time of exposure after attainment of the specific temperature and do not include heat up or lag time. Time-temperature relationship is recommended, or other time-temperature relationships recommended by manufacturer of instrument. For moist heat, or the autoclave, 15 minutes at 121 degrees Celsius, that's 250 degrees Fahrenheit, at 15 psi, which means pounds per square inch. The above exposure time relates only to the time the material is at temperature and does not include a penetration or heat up lag time. Chemical, also known as color change indicators, should be used on each package to assure that each package has been processed through a sterilization cycle. Biological monitoring is the only assurance that sterilization has been achieved. New instruments should be cleaned and sterilized before use. Pre-made needles and disposable tubes from a manufacturer should be sterilized before use. Sterilized items that become contaminated before use, such as dropping or touching a soiled surface, should be reprocessed before use. Unused instruments in containers that have been opened should be reprocessed after a 24-hour period. All containers holding contaminated needles and tubes and container lids should be cleaned and sterilized daily or whenever needed, such as if they become overtly contaminated.
Your instruments will need to soak in the cleaning solution for 2 minutes prior to cleaning. There is a timer at each location. To make the cleaning solution, you will use a half a pump of the multi-enzymatic cleaner and fill the rest of the pan with water. Wear gloves when cleaning your instruments. Each instrument needs to be scrubbed thoroughly. Put on new gloves, dry the excess water, and package your instruments in the open position. Tear off the plastic seal and fold at the perforated line. This is an incorrect fold because there is not an airtight seal. We have found a few instruments with material still stuck to them. So now we will be initialing our instrument pouches at the upper right-hand corner. If you package the instruments, you must initial your pouch. Please note, the back of the instrument pouches have a circle steam indicator. If the pouch is dirty, the indicator will be pink. After proper sterilization, the indicator turns from pink to brown. Never put a pouch in the clean bucket if the indicator is still pink. This is an easy mistake, but puts our patient's health and safety at risk. You are now ready for the autoclave. Never put instruments in the autoclave and walk away, especially at the end of the day. Someone may walk by or come in the morning thinking that they're clean and take them out. Check the water level and fill as necessary. The water is located underneath the autoclave. Close the door, press the pouches button, and then start. Once the autoclave is done, you will tear off the receipt and use this information to fill out the clipboard on top of the autoclave. We need to document the date, the receipt number, the maximum temperature, the maximum pressure, the number of minutes the autoclave was at 270 degrees Fahrenheit, and also document that the circle steam indicator is brown. All of our records need to be accurate and up to date for Board of Health inspection.
Section 3. Environmental Control and Housekeeping. A proper hygienic environment should be a goal of the intradermal cosmetic technician and instructor. The procedure of implanting pigment with the dermis layer of skin is paramount and results in blood contamination of pigments and pigment containers and related surfaces. Critical care items are those that come in direct contact with the bloodstream and other normally sterile areas of the body. Therefore, any pigments exposed to air, for example, poured from a covered holding container to disposable pigmented container, regardless if unused in treatment, must be viewed as potentially contaminated and disposed of after each client to reduce the transmission of infection and disease. A variety of microorganisms are normal contaminants of environmental surfaces. Therefore, routine cleaning and removal of soil are recommended. Most microorganisms found on environmental surfaces are non-pathogens, but conscientious sanitation and disinfectant techniques control cross-infections. The environment should be clean, well lighted, and provide good ventilation. A sink with hot and cold running water should be located in each treatment room. Toilet facilities should be available. Fresh, disposable, waterproof linens should be used on the treatment chair or table for each client. They should also be stored in a closed cabinet. Disposable items should be discarded into a container lined with a plastic bag and removed daily. Soiled linen should be placed into a container lined with a plastic bag and removed weekly. Fresh pigment and disposable pigment cups should be used for each client. Used pigment containers and pigment exposed to air should be discarded into a container lined with a plastic band and removed daily. New disposable pigment cups should be sanitized before use by submersion in the 70% isopropyl alcohol for at least 10 minutes. The covered container used to hold the alcohol should be emptied at least weekly or whenever visibly contaminated, then cleaned, dried, and refilled with fresh alcohol. Sinks and toilet facilities should be cleaned daily. Equipment surfaces, doorknobs, telephones, and treatment tables should be cleaned on a regular basis. Floors and/or carpets should be vacuumed and cleaned regularly. Walls and blinds should be cleaned when visibly soiled. Sterilizers should be cleaned according to the manufacturer's instructions. Any disposable items such as cotton balls, swabs, tissues, water cups, new or used, that have come into contact with the treatment or work area should be disposed of after each client. Said items should be discarded into a container lined with a plastic bag and removed daily. Magnifier lamp or treatment lamp should be wiped with a detergent germicide after each treatment. Hospital-grade disinfectant detergent registered with the U.S. Environmental Protection Agency, or EPA, should be used for environmental surface cleaning, but the actual physical removal of organisms by scrubbing is probably as important, if not more so, than an antimicrobial effect of the cleaning agent used. Product labels give the EPA registration number and should give adequate safety and precautionary information. Disinfectant fogging is an unsatisfactory method of decontaminating air and surfaces and is not recommended. Cleaning schedules and methods vary according to the type of surface to be cleaned and the amount and type of soil present. Countertops should be of smooth, non-porous materials and cleaned daily, taking special care in the areas where the procedures of cleaning and sterilization of instruments take place. The exterior and interior, where indicated, of containers kept on the countertop should be maintained in a sanitary manner. Sinks and toilet facilities should be cleaned daily. Equipment surfaces, doorknobs, telephone, and treatment tables should be cleaned on a regular basis. Floors, carpets should be vacuumed and cleaned regularly. Walls and curtains should be cleaned when visibly soiled. Sterilizers should be cleaned according to the manufacturer's instructions. Although blood spills on environmental surfaces would be rare, should they occur, the following cleaning procedure would be used. Gloves should be worn to clean up the spill, and paper towels used to blot up the visible material. Paper towels used to clean up the spill should be discarded into a plastic bag, securely fastened and disposed into the regular trash. The area should then be wiped down with paper towels and an EPA-registered disinfectant detergent, or at 1 to 100 dilutions of household bleach and water, which is also a 1/4 cup of bleach to 1 gallon water, and then wipe dry. Paper towels and gloves should then be discarded into a plastic bag, securely fastened and disposed into the regular trash. You can find these and other supplies at thefineartsofbeauty.com. Click on the SOFAB supply list and allow it to load for a few minutes. Then scroll down and you'll see a variety of different reading material. You'll also find a variety of practice skins, as well as carrying cases and other supplies, such as your masks, your gloves, and everything you'll need to get started. Or replenish your supplies as you go. A past and current health history should be maintained on each client. Since health history cannot reliably identify all clients infected with blood or body fluid pathogens, precautions should be consistently used for each client. The surface is the most common site of many microorganisms. A thorough examination of skin surfaces is necessary prior to any treatment. Skin sites require pre- and post-treatment procedures. A complete past and current health history should be obtained from the client on the initial visit. The practitioner should evaluate the history on a current basis prior to any treatment. An evaluation of the skin site and an examination for signs and infections or rashes should take place prior to any treatment. Treatment should be delayed if actual or potential signs of symptoms of infection are present. The practitioner should refer the client to an appropriate physician when evaluation of skin surfaces or history assessment indicates. Blood and body fluid precautions should be consistently used for all clients. Prior to treatment, the skin site should be cleaned of visible soil with soap and water or a germicidal skin preparation, then wiped with an acceptable antiseptic product such as 70% isopropyl alcohol or other acceptable antiseptic product. An antiseptic is a substance that is used on or in living tissue to inhibit or destroy microorganisms. An antiseptic should be applied with a fresh, non-sterile cotton ball. The area should be allowed to dry thoroughly before treatment. After treatment, the skin site should be wiped with an acceptable antiseptic applied with a fresh, non-sterile cotton ball. Alcohol and antiseptics containing large amounts of alcohol may cause burning and redness when used as a post-treatment antiseptic. Antiseptics such as hydrogen peroxide may cause less irritation to the treated skin sites. An application of a cool compress and healing cream, lotion, or ointment may be applied to the treated area site at the discretion of the practitioner. Creams, lotions, and ointments should be stored in clean covered containers and used in an aseptic manner. Clients should be instructed on the appropriate post-treatment care to promote healing of the treated skin surface. The general health status of the client may be a predisposing factor in susceptibility to infection and normal healing.